Welcome, dear viewers, to our show Natural Medicine. Today, we are talking about the so-called gold implants. Unfortunately, this is still a topic that very few people know about. That's why it's so important for me to talk about it. Today, however, we have the doctor here who brought this to our studio as a topic and made thousands of people happy by preventing surgeries to be performed on the hips, joints, knees, shoulders, feet, etc. Here he is, Dr. Harald Burgard. Welcome, dear Harald.
Hello, Alexander. Good morning. Thank you for inviting me.
I still remember our first conversation when you told me how you got the gold implants, this revolutionary, simple technology, and when you went home to your wife and told her you had something new. And she simply said, "That's nothing new, we've known veterinary medicine for a long time." I thought that was funny. In the meantime, I've had a few veterinarians here. Unfortunately, not every animal has the chance to get such a blessed treatment. Well, we're lucky to have your wife here today. She joined us via Zoom. She's a veterinarian and scientist for a pharmaceutical company in the field of medicinal drugs. Welcome, dear Mrs. Burgard.
Hello.
You're online in the studio. Thank you very much for being here. Can you tell me, how did you originally come across this? Why has veterinary medicine been around for so long? What do you know about it?
I can't tell you why it's been around for so long, but I know that it's been around for over 20 years in veterinary medicine and is being used. About 10 years ago, I came across it via a colleague. She had done a lot with acupuncture back then. She told me that she used gold acupuncture, and it was very successful. Animals also have joint problems. The best example is hip dysplasia. She told me that she uses it and has really great success with it.
I once had a shepherd dog and he broke down in misery with his hip. It's just sad. I have various reports. My mother has already made her knee with incredible success. But we'll document that separately. You yourself have also tested it. Did you ever have a health problem?
Yes, exactly. I've had a hallux valgus for a long time. I would say for over 20 years. But that never affected me. I've never had pain either. I've always done a lot of sports. I've never had any impairments. However, that has changed over the last 5 years. I have it on my right foot, and it gradually became painful. I do karate. We walk barefoot there and move a lot. The foot is challenged a lot by kicks. I noticed afterwards that I was getting more and more pain. It got so bad that I felt like I was getting a ray of fire into my big toe. It was very unpleasant and very painful. I thought about what I could do now. I went to an orthopedist and had my joint x-rayed. They found that I had this misalignment. You can see it like that, and that there is already arthrosis in that area. Then I had my insertions prescribed in the first step. That was good, but I can't wear them in sports. I walk around barefoot a lot. I had to think of an alternative. An operation was
Eine
out of the question
Operation
for
kam für
me.
mich nicht in Frage. Und ja,
When
als
my
mein
husband
Mann
told me that
erzählt
he was
hat,
going to
dass er
start
dann
the
mit
gold
der
implant, I was very interested.
Goldimplantation beginnt, war ich natürlich sehr, sehr interessiert.
Then we
Ja,
decided to
und
do it.
dann haben wir beschlossen, dass wir das dann machen lassen.
I think
Und
it's been 2
ja,
months since I
das
had
habe
it
ich erst
done.
vor, ich glaube, es ist jetzt so knapp 2 Monate her, dass ich das habe durchführen lassen.
Oh,
Erst
2
2
months.
Monate. Okay.
Ja.
Okay.
Did
Hat
you
man
want to
mit den
treat the arthrosis with the
Goldimplantaten die
gold
Arthrose
implants or the
behandeln
hallux?
wollen oder den Hallux?
The bulge is clearly removed from the normal
Wölbung, die
foot
geht
shape.
ganz deutlich weg aus der normalen Fußform.
Can it still form back,
Kann
or
sich
is
die
it
noch
just about reducing the
zurückbilden oder geht es
inflammation?
einfach darum, die Entzündung zu reduzieren?
The hallux
Also
itself
der
is not
Hallux an
formed
sich,
back by the gold
der
implant,
wird nicht durch die Goldimplantation zurückgebildet.
but what is
Aber was
achieved is
erreicht
a
wird,
very
ist eine
drastic pain
ganz, ganz
reduction.
drastische Schmerzreduktion.
I
Und
noticed
die
that
haben
right
wir
away.
auch im Prinzip sofort gemerkt.
I was really
Ja, also
impressed.
das war wirklich, ich war echt beeindruckt. Ich
I would
würde mal
say
sagen,
at
also
least
mindestens
90% pain reduction from the
90%
beginning.
Schmerzreduktion von Anfang an. Ich
I
merke es
notice that I
zwischendurch,
have slight
dass ich
itching in
nochmal ein
between.
leichtes Ziehen habe und
Ah,
ja, so
that's
war
how it
das
was back then.
damals.
But I think it's a great success.
Ja, aber es ist wirklich ein toller Erfolg, finde ich.
My mother had
Meiner
it for
Mutter
2
ging
or
es
3
etwa 2,
months.
3 Monate. Jetzt
Now
etwa
she
so
has
nach
almost no
6
problems
Monaten
after
hat sie
6
das gar
months.
kein Problem mehr. Aber
But
so
after
nach
one
einem
day,
Tag,
that's a
das
highlight.
ist natürlich schon ein Highlight.
But
Und
now
jetzt
it's
geht's
back to
aber auch schon
karate.
wieder bei Karate. Ich meine,
You
da
have to
kommt
hit
es
with your
bei
feet.
Fußschlägen. Ich meine, da gibt
There's a
ja
bang,
einen
a
Prall,
hit,
einen Aufschlag.
and the pain is gone, or
Und da ist der
90%
Schmerz
gone.
auch nicht mehr da oder zu 90% weg.
Ja,
Yes,
der
I don't
ist,
feel any pain in
also ich
karate.
merke beim Karate jetzt keinen Schmerz.
I still try
Ich
to hold back a
versuche
little.
immer noch so ein bisschen ja, mich zurückzuhalten, sagen wir
I
mal
don't
so.
want
Ich
to
möchte nicht
exaggerate.
übertreiben.
But I don't
Aber
feel any
ich
pain
habe
during sports.
keinen Schmerz während des Sports.
It's
Also
really
es ist
great.
wirklich ganz toll.
Now a
Jetzt
lot
hören
of
ja auch
people are
ganz viele
listening.
Menschen zu und lauschen ihren Lippen. Und
Who
jetzt
would you
möchte
recommend
Lukas
this
Sie
to?
auch gerne mal bitten zu sagen, wem würden Sie das jetzt alles empfehlen,
Before
bevor
you
Sie sich
get an
jetzt
operation,
irgendwie eine Operation gönnen? Bei
what kind
welcher
of patient
Art
would you
von
recommend?
Patienten oder Menschen würden Sie sagen, achtet doch bitte mal auf Goldimplantate?
Naja, also
I would recommend
generell
it
würde
to
ich's,
people who have the same
also
problem
den
as me.
Menschen eben empfehlen, die das gleiche Problem haben, jetzt wie ich.
Hallux
Ein
is
Hallux,
relatively
das
common,
ist ja
especially in
kommt ja
women.
relativ häufig vor vor allen Dingen bei Frauen.
Why
Und
more in women?
ja,
I don't
Warum eher
understand.
bei Frauen? Das verstehe ich gar nicht.
I read
ich
that
habe
women are more
gelesen,
affected.
ja, ich habe gelesen, dass Frauen häufiger betroffen sind.
Genetically, because of a
Genetisch
weaker
bedingt,
connective tissue.
wegen eines schwächeren Bindegewebes.
That's
Das
what
war
I
das, was
read.
ich gelesen habe.
In general, I
Und
would recommend
generell
it to
würde ich es
people who
Menschen
don't want to have surgery right
empfehlen,
away.
die eben auch sich nicht sofort operieren lassen wollen.
I
Ich
just
habe
had
halt
the
einfach die
concern that
Bedenken,
after an
dass ich
operation,
nach
I would
einer
have more complaints or
Operation,
not come back to sports.
ja, wie soll ich sagen, noch mehr Beschwerden habe oder nicht wieder so zurückkomme, auch in den Sport. Ich hatte
I was
einfach
just afraid of
Angst
it.
davor. Und
That's
deswegen
why
war
it
das für
wasn't
mich
an
so
option
auch
for
keine
me.
Option. Und von daher
That's why
fand
I
ich
thought the gold implantation was great,
die Goldimplantation einfach super, weil das
because it's
wirklich
a
ein
relatively uncomplicated procedure.
relativ unkomplizierter Eingriff ist und man ja auch schon im
And you can already
Prinzip
put pressure
einen
on your
Tag
foot a day
später
later.
wieder relativ normal den Fuß auch belasten kann. Ja,
You
also
shouldn't go
man sollte
straight
jetzt
back
nicht
to high
direkt wieder
performance
im
sports.
Hochleistungssport gehen, aber
But
es
it's
ist
just
einfach
uncomplicated and with
unkompliziert
great
und
success.
mit einem tollen Erfolg.
And people who have knee
Und
problems,
Menschen, die
hip,
jetzt
back,
Knieprobleme,
shoulder, would you
Hüfte,
recommend them to
Rücken,
just deal with this
Schultern, würden
topic?
Sie auch denen empfehlen, sich da einfach mal mit diesem Thema zu beschäftigen?
Definitely.
Definitiv.
Wie
How do you
erklären Sie
explain
sich
the
die
effect so
Wirkung so
quickly?
schnell?
You are a
Sie sind ja
scientist and also a
Wissenschaftlerin
vet.
und auch noch Tierärztin. Wie
How do you
erklären Sie
explain
sich das?
that?
I can't say why it's going so fast.
Warum es jetzt so schnell geht, kann ich jetzt auch nicht sagen.
My
Mein Mann hat
husband tried to
mir
explain to me what the gold
versucht
implants
zu
do,
erklären, was die Goldimplantate auslösen und
and
dass
that
sie
they
halt
also
einfach auch
minimize
die
the inflammation reaction.
Entzündungsreaktion minimieren.
That
Und
makes sense
das
to
macht
me.
für mich alles Sinn. Und
I
ich
just
denke
think that
einfach,
some people
dass
react faster to it than others.
manche anspringen, ja, wie andere eben.
I can only
Und,
say that it helped me very quickly.
also ich kann nur sagen, bei mir hat's sehr schnell geholfen.
2 more questions for you,
Noch,
dear
zwei
Dr.
Fragen
Burgard.
an Sie, liebe
Gerne.
Frau Dr. Burgard. Die eine
One is
ist,
about the vet.
in Bezug der Tierärzte.
Do vets learn something in their
Lernen das
training?
Tierärzte irgendwo in der Ausbildung oder ist es
Or is
auch
it something that a
irgendwie
vet would have to
etwas,
learn
was
in
ein
further
Tierarzt
training?
irgendwie in Weiterbildungen sich selber aneignen müsste?
Gold
Also,
implantation or gold acupuncture is something you don't learn in your studies.
Gold-Akupunktur, ist etwas, was man im Studium nicht lernt. Das ist etwas,
It's
was
something
man,
you would have to learn later if you are interested in
später
it.
aneignen müsste, wenn man sich dafür interessiert.
You would
Und,
have to continue your training in
müsste
that
in dem
area.
Bereich eine Weiterbildung machen.
It's
Also, es ist im
similar to what
Prinzip
my
ähnlich, wie
husband
mein Mann
did.
das jetzt auch gemacht hat. Er hat
He
sich an
worked
dem
on the
Thema
topic and it would be the
eingearbeitet,
same for a vet.
und ja, so würde das bei einem Tierarzt auch laufen.
All animal fans or friends who see their cat or dog suffering should really contact a vet to ask if they know anything about gold implants.
Mit einem Tierarzt mal in Verbindung bringen, auch da nachzufragen, ob etwas von Goldimplantate kennt.
And maybe they could
Und
act to
hier
reduce the
vielleicht auch
suffering.
könnte, das Leid zu reduzieren.
I know that there are
Ich
many
weiß
groups
dass
of
es
interest who put an
sehr
operation in
viele
the foreground.
Gruppierungen gibt, die natürlich sofort eine Operation in den Vordergrund stellen.
But they
weil
only
sie
offer that and nothing
letztendlich
else.
nur das anbieten und das andere nicht. Und deshalb
That's
wird
why
auch
it's very
sehr
one-sided
einseitig
explained.
aufgeklärt. Und da
I'm a
bin ich
big
einfach
fan of gold
großer
implants
Freund
and
von
I'm happy to talk about an
Goldimplantaten, darüber zu
alternative.
reden, dass es auch eine Alternative gibt.
Thank you very
Deshalb
much.
meinen herzlichsten Dank. Die
The last
letzte
question.
Frage. Was haben Sie für
What
ein
kind of
Blut?
belt do you have?
The black one.
Ja, natürlich.
Yes, of course. I think, dear Harold, you have to be careful at home.
Lieber Harald, du musst aufpassen zu Hause, gell?
Follow the
Schön
rules.
anständig, schön folgen.
Thank you very much, dear Dr.
Ich
Burgard.
bedanke mich ganz herzlich bei Ihnen, liebe Frau Dr. Burgard.
Thank you very
Herzlichen
much
Dank
for
dieses
this interview
Gespräch und
and
für
for these
diese
explanations.
Erläuterungen. Wir werden
We
noch
will show
einen
a foot of
Fuß von
yours.
Ihnen zeigen.
We got a
Wir haben ein
picture
Bild
and we will
bekommen,
show it
das werden
after we
wir
say
als
goodbye to each
Nachgang,
other.
wenn ich Sie verabschiedet habe, noch zeigen.
All
Alles
the best for
Gute.
your foot and your
Für Ihren
sport
Fuß
and
und
for
Ihren
your work.
Sport und für Ihr Wirken. Bis
See you
dann.
next time.
Tschüss,
Bye.
Frau Burgard. Tschüss.
That was very
Das war
exciting.
mega spannend. Danke
Thank
ganz
you very
herzlich,
much,
lieber Harald,
dear
dass Sie meine
Harold,
Frau
for inviting your
eingeladen
wife.
hast. War jetzt wirklich
It was
auch
really
spannend
exciting.
und, ich muss schon
I
sagen,
have to say,
beim
I was
Fuß
surprised
hat's
by the
mich
foot.
gewundert,
If it hurts so
wenn
much
der
that you
so
have such a
schmerzt,
result in such a
dass
short
man
time,
innerhalb von so kurzer Zeit solche Erfolge hat. Das
that was
war
surprising.
überraschend.
You heard, my wife has had this problem for years. I always said, let's go to the orthopedist. It's a matter of time. At some point, she really pushed me so hard that I said, okay, let's do it. And we did it. It worked faster than I expected. I always do a special technique for small joints. I put these little pieces of gold in there, but also very finely pulverized gold, which then spreads better around these small joints.
That's extremely small, isn't it?
Klein, oder?
Yes, that's very small. It's a small joint, you can't put big pieces of gold in there. Otherwise you'll get a lot of little dents. And you have to walk. If you wear shoes and it presses here, then of course you can't press the gold on the joint. And that's not the case. Many people have had surgery and still have complaints. She didn't have surgery, but she just had increasing pain. And here you can see these red spots in the picture. These are the points where I put the gold in.
Wie viel war
How much was that? 5, 6?
That was directly with the surgery. You can still see the tissue from the surgery. That's a little swollen for day 2, of course, until it goes back. But she doesn't have any pain anymore, or just a little bit. But it's only been 2 months. We always tell people that they have to wait 3 to 4 months. And we still see improvements in a period of a year to a year and a half. And then comes a steady state where the level that was achieved remains. So it took off quickly. But she's basically healthy. Sometimes you have patients who have immunosuppressing measures. They have a lot of inflammation. And the immune system is also busy at other points. And obviously can't release as many gold ions as someone who has a relatively good immune system. That seems to be the reason why it works fast for one and not so fast for the other. But sometimes we have people. I had a patient who had a knee arthrosis where the bones were not only on top of each other, but almost in each other. I thought, will that work at all? We also discussed this with the patient. And she called me a few days later and said, "I'm pain-free. Can you do the other knee for me?" And then I thought, she's making jokes. But it was actually so. And she came and we did both and both are good. So sometimes you are surprised. How many implants did you put on your wife?
If we look at the picture, it's 4 or 5 holes, right?
Exactly. I put a piece of gold in 6 places. And then I also distributed some pulverized material on the surface, so that the whole joint is relatively heavily covered. And that leads to a relatively fast and permanent pain relief. The effect is always that the inflammatory cells that are in the tissue are calmed. Because the gold is there, the inflammatory substances are reduced. And then the swelling goes down, the inflammation goes down, and thus the pain. And that lasts a long time, because it stays in there for a lifetime.
I would like you to confirm a view that I have. An inflammation process. An inflammation always has an electron deficiency. That's where the redness and the pain come from. A clear lack of electrons. And you said that gold releases ions. That means this ion goes into the inflammation. And in this regard, the inflammation gets energy and reduces its inflammatory process.
According to what science has shown, cells of the tissue, macrophages, and other cells come and release particles from the gold. This is called dissolucytosis. And then a gold particle membrane is created, which causes the inflammatory cells to absorb these particles and then reduce their own excretions from inflammatory substances. In the tissue, inflammation occurs because NFB and other substances are excreted. And they cause inflammation, swelling, and thus pain. And this excretion is blocked because these cells, when they absorb the gold, stop it. We have known for thousands of years that gold is the metal with the strongest anti-inflammatory effect. And through university research, it has been found out how it works. This was proven in 2008, 2009 by a group from Aarhus. This is the effect. I can't say how far electrons play a role. But if inflammatory substances are no longer formed in a tissue, the inflammation goes back there. And if the inflammation goes away, the pain goes away. This is the advantage.
I am a great friend of cause-related treatments, like you. But with your wife, you have to say, how do you get rid of an inflamed hallux when it really hurts? Via the milu hardly possible, right?
I am also a fan of cause-related therapy. I've been doing this for over 20 years. But where a joint is destroyed, I can't do anything about the cause. I have to make sure that I get the pain under control. And of course I can do that by doing an operation by cutting something off. Or I put gold around it, whether it's a knee, hip, or whatever. This leads to the fact that the inflammation permanently disappears with a single intervention. From my point of view, this is a non-destructive procedure. You keep your own joint and can move freely. You heard, she does karate. With black belt you do a little intense training or very intense. And yet she is pain-free.
My question is, when is the point when you don't have to try to solve the problem by natural means, by nutrition, and so on? But rather say, now a gold implant has to go. Let's take the example of the knee. A knee pain also doesn't come overnight. Whether it's spinal cord malfunctions, inflammation processes, heavy metal load, that cause inflammation processes, they store everything here, no idea. When is the point to really pull this plan B out of the bag?
In general, when the conservative measures, injection, acupuncture, hyaluronic acid, plasma, physiotherapy, etc. When these things are exhausted, at the latest then the point has come where either the orthopedist says, we need a new joint, or where we say, you should intervene with a gold implant so that the spook stops. Personally, I think the sooner you do that, the better it is. Because the sooner I do a gold implant around a painful joint, the sooner I can stop the inflammation process, which also leads to further destruction. That's also when I start early in prevention. I can't heal a destroyed joint, but you can walk without any further pain on a damaged cartilage. And that decades. If the bone is destroyed, of course, that's why we always look at the X-rays, then you have to do an implant. There are also criteria where you can say, you can't do a gold implant anymore, you have to do a new joint. But in most cases, the gold implant helps to significantly reduce the pain or in many cases to get it completely away.
I remember 2 patients of yours who I was allowed to interview, and both of them told me a recommendation out there. Or what would you do better in your life if you could? They both said, I wouldn't wait that long and get a gold implant faster. Because the pain level is increasing and increasing and the quality of life is decreasing extremely. One couldn't walk at all, and after the gold implant, he was able to walk without any problems. The pain level was really reduced. Then I also asked myself, when do you start? Then we are back to the question. And which therapist would recommend that to me? If I don't know them, the doctor will always go out for the operation because he learned it that way. That's right. I understand.
I can only recommend what I know. We just didn't learn it as doctors. And to hesitate is human. You heard it. My wife, I've been doing therapy for a long time now. We did it with her 2 months ago. But not because we had the idea, but because she asked me so many times and I just didn't have time. And that's how it works with other people too. They carry the problem around until it's no longer possible. And then you think, okay, now the doctor says, I have to get a new knee. What options do I have? And then you might hear about the coincidence of the gold implant and do something like that. Or not. And then you do a new joint replacement. So the sooner you start, the better. And the less pain, the less time you have the complaints. But reality shows that you take things into action when it's no longer possible.
Downtime. If you do such an operation, you come in the morning and in the afternoon you're back on the way home. And you can walk normally, right?
Yes, absolutely. So that's the case with all patients. I had 2 more patients operated yesterday. I did a hip and a knee. They come, you do the intervention. They sit there as long as the anesthetic works. Maybe another half hour until the muscles work again the way they should work because they are anesthetized. And then they get up and go. Sometimes they go for a walk on the same day or just drive home. Do a normal daily routine. Do the plaster off the next day, take a shower, bathe, do everything and WPNT be out. And then they can work the next day. There are always people who say, I don't have the chance to have treatment for another 6 weeks or to lie in the hospital for weeks or whatever. I would and must be able to continue. And you can do that with the gold implants without further ado. The pain is almost zero. So we have maybe 1 in 10 patients who still have to take ibuprofen in the evening. Because the pain is a little stronger. The others say we didn't have to take anything. And then on the same day, either walk or whatever. You can't exaggerate. Performance sports and jogging and such things are of course not possible. But normal things at all times.
Now you just said last night that this risk of failure is no longer there. If I have an operation in my knee or hip, I'll be out for a long time and not here. I would like to ask a little more about the cost. I mean, it's not something that the statutory health insurance pays for, is it? Such an intervention.
In Germany, the statutory health insurance companies usually don't pay. Sometimes you're lucky and can get a compensation if you prove that it worked. With the private sector, we have seen that it is often compensated. But sometimes yes, sometimes no. That may also depend on the person responsible, I don't know. So it's usually a private service, but also one that I think can be financed. The costs are somewhere between 2,200 and 2,300 euros. That's a lot of money, but not excessive.
Compared to an operation in a hospital with all the stuff.
There we are at 10,000.
And more. So it's always worth a try. Have you ever had to say, we really tried it, but in this case it didn't work?
There is no therapy that works for everyone. We say that to the patient very openly. We also asked all the patients who had surgery. We do that from the beginning. Also my colleagues and we know that about 5 to 6% have no success. What I personally saw, those were people who either had a very twisted spine, where the pressure conditions on the spine were so bad that the implantation hardly improved it. And what we also see when people take cortisone or have severe rheumatism, then you have to solve this problem first, because the immune system is not able to attack gold through cortisone. These are the two main points. But with everyone else you can see that the gold implantation brings a very, very good improvement. In most cases, people are even pain-free after a while. And that permanently.
How many therapists do that today? How many doctors and physicians offer this already today?
I think we are now in Europe 5 or 6 or 7. So it's not enough yet.
Well, what can you do? Many doctors and therapists are watching. Can they get trained?
Yes, we have the European Academy for Gold Implantation, which has simply rested a bit due to all the corona restrictions. We will train colleagues, but you also have to do it in such a way that you have an education. Because even if it is a simple technique at first glance, there are things that you have to pay attention to, that it works and that you do not cause damage afterwards, that you could have avoided.
It's always the same, you have to do it well.
Yes, absolutely.
If you only have one case where it doesn't work well, then it's a found food for the whole lobby. Therefore, it must never go wrong. It has to run as it is according to protocol. Great, thank you very much, dear Dr. Med. Harald Burgard was that for you, dear viewers, experts in the field of gold implantology. And I just have to say, it's great to know that this exists at all. As a plan B, if we really have any problems, we have to get them under control again without surgery. And you have seen it here too, it is not only for people, but also for veterinary medicine, a very, very important option. And now that we all know that, and maybe our animal or a friend has problems, then we can also look for the right doctor or the right vet who is familiar with it and at least implements this experiment for the benefit of humans and for the benefit of our animals. All the best, see you next time and take care.